More than 200 jurisdictions in this country have declared that racism is a public health crisis. Racism permeates every aspect of our society. The false belief in a hierarchy of human value has always been an organizing meme of the United States, and so it determines opportunities to earn a living, it determines where we live, it determines the day-to-day stresses that we are exposed to. Racism is the driver of the social determinants of well-being, and we finally understand that the cumulative effects have created a crisis in this country. The mission of the National Collaborative for Health Equity is to promote health and end health inequities. Collaborative is in the center of our name, and it really embodies the way in which we work. We know that we have to work together to end racism, and that is the only way to end health inequities.
The National Collaborative for Health Equity really started as the Health Policy Institute of the Joint Center for Political and Economic Studies, and Gail Christopher led that unit at the Joint Center for many years. When she left the Joint Center in 2006, I was appointed in her role and was really delighted to try to carry forward some of the work that Dr. Christopher initially developed. One of those initiatives was Place Matters, which was a national initiative, an effort to build the capacity of leaders in communities around the country to come together to address the important role of place as a determinant of health. And of course, that framing, place, allowed us to open a window into understanding a form of structural racism, residential segregation.
In Chicago, which has historically been one of the cities with the highest amount of racial residential segregation, we see a recurring pattern of inequities, of life expectancy, and of health status in general. There was a polluter named General Iron, which was being really forced by the city to move after a horrendous history of explosions and literally things they call auto fluff coming down from the sky and landing on the sidewalks. So Mayor Emanuel started the process of moving the polluter, General Iron, to a community of working class folks, and at that point residents of Southeast Environmental Task Force, the National Resources Defense Council, and other local organizations started organizing. After pressure and intervention from Michael Regan of the federal EPA, the city and the health department denied the permit, and we stopped General Iron. NCHE provides unique resources. It really respects local contexts. It doesn't push a cookie cutter, one-size-fits-all approach. It's not a cookbook. It's about building relationships and really building understanding. It's a community of practice.
NCHE works to achieve our mission through three primary pillars. And one is supporting and working in collaboration with local community leaders. Another pillar that's central to our work is relevant data, information, and research. And we have a wonderful initiative that we call the Hope Data Initiative that reframes data, not just to reinforce and reiterate the inequities, but to set measurable goals to achieve health equity.
The VCU Center on Society and Health has been a partner with the National Collaborative for Health Equity on the HOPE project since the project's inception in 2018, and I've served as the lead for my center's team throughout this time. If we can't or won't measure health inequities, we cannot properly prioritize actions to address them. So one thing that's clear across the nation and the various HOPE measures is that we cannot achieve good population health without addressing the gaps by race, ethnicity, and socioeconomic status.
We're very excited that our Hope Data Initiative enabled us to gather a set of indicators and to group them in domains that are all focused on what people need to have the opportunity to live healthy lives. Our last pillar is supporting this growing movement for truth, racial healing, and transformation in this country. It is finally time for America to do what over 40 other countries have already done, which is to face the truth of our past, to heal from that past, and to transform our society so that these conditions that foster inequities no longer define our culture and our ethos.
Racial healing is a set of activities and methodologies and commitments that result in people seeing each other past race and past other man-made human differences. Racial healing is needed to help us be able to come together so that we can start to solve the larger problems that impact us.
The racial healing circles that were designed by Dr. Gail, the concept of it, I think the thing that's most incredible about it is how it brings different people together who never probably would have had such personal conversations, and allows them to start a process of having a conversation with someone from the heart and telling the truth.
Reverend Dr. Martin Luther King had a quote that said, "We must learn to live together as brothers and sisters or perish together as fools." And so racial healing circles help anyone because they help you to be able to see your common humanity in another person. They help you be able to tell your story, and they help you be able to understand the stories of others.
The National Collaborative for Health Equity was created about 20 years ago when we were just beginning to understand the social determinants of health. Our vision for NCHE is to continue to be a partner with others in achieving a cultural transformation in this country where America truly becomes a culture of health for all.